And her husband got annoyed with her because he's like, why are you so upset if someone else is pregnant? That's not rational. And I said, haul him down here. I'd never met this guy. And I basically gave him a 20-minute lecture on why it's entirely normal for someone going through infertility to be devastated by anybody, including a celebrity getting pregnant. It's just normal.
Family building is supposed to be easy, and it can be a shock when it's not. The roller coaster ride of infertility can be a mix of emotions and conflicting advice along the way. As a reproductive endocrinologist and former fertility patient, I not only help patients build families every day, but I remember what the ride was like for me. Hang on tight as we learn together from experts and share stories from infertility warriors. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. Welcome to Baby or Bust. My guest today is Dr. Ali Domar. Dr. Domar is a world leader in mind-body medicine. She has spent her career researching and educating about the relationship between emotional stress and physical health. Welcome, Dr. Domar.
Thanks, Laura.
So you have spent your career researching the mind-body connection. So, does stress cause infertility?
Yes.
I love that you're so direct. Nobody will give direct answers to that question.
I do believe that stress causes infertility. And if you look at pretty much every animal species, when you stress out an animal, reproduction plummets. And so it wouldn't make sense that every animal is reproductively sensitive to stress other than human beings. I think it's really hard to prove. That one of the first studies which gave us a good inkling was Courtney Lynch's study. She's a reproductive epidemiologist at Ohio State. They looked at, I don't remember how many couples it was, who threw away the birth control. They weren't infertility patients. They just threw away the birth control. Mm-hmm. And what they found was the women who had the highest levels of what's called salivary amylase, which is it's sort of like cortisol. It's a rough assessment of stress.
Okay.
The women who had the highest salivary amylase levels at baseline before they started trying not only took the longest to get pregnant, but were much more likely to then experience infertility.
And that's an interesting way of looking at it because I feel like stress and infertility are so interrelated. It's sort of like the chicken or the egg, which came first?
It's the question I've been asked all the time in my career. And in fact, one of my fellows years ago actually got me a chicken and an egg. So it's sitting on the windowsill of my office. It's a chicken and an egg. Infertility causes tremendous stress. And in fact, we just published a paper a few months ago looking at women with infertility during the COVID surge last spring. And we found that infertility was still higher in terms of stressors in their life, even in the middle of the surge in Boston. And we had a really bad surge last spring. I published a paper 20 or 25 years ago showing that women with cancer, AIDS, or heart disease were equivalent to infertility patients in terms of anxiety and depression. So honestly, I didn't think that COVID was going to be worse for our patients. And I was right. Patients still rank COVID as less than infertility. So we know infertility causes stress for a zillion different reasons. It impacts every area of a woman or a couple's life or, a man's life. And I think everyone agrees infertility causes stress. But the hotter topic is, does stress cause infertility? Almost all the research to date has been on IVF patients because it's a clean population. Mm-hmm. So this is our first sort of hardcore evidence that indeed stress may be associated with lower pregnancy rates.
I will say, as a fertility doctor, this is one of the most common questions that I get.
Yep.
Hey, Dr. Shahine, does stress cause infertility? And it's for my male and female patients. And I will say that my answer has changed over time. The longer I practice, the more humble I get. And so when I first started, I would really hang on those studies that showed, stress does not impact IVF success rate. Stress does not impact your fertility. Because as a doctor, I couldn't really fix that variable. If someone's blood pressure is high, I can give them a medication, or if their thyroid isn't working, I can fix that. But it's really an uncomfortable place to be as a doctor to say, yeah, it might. And, how are we going to fix that? How do we be honest about that connection, but then help people manage their stress in order to improve their fertility?
if I had a choice and I had a healthy young woman who was stressed out and was trying to get pregnant, and I had a choice of her taking a medication that blocks some area of her hypothalamus versus learning some basic mind-body skills that we know are going to reduce stress and increase pregnancy rates, I think I'd go with the mind-body skills.
Well, and talk about your research, because you have shown that your mind-body skills and actively managing stress has improved fertility. You've shown it time and time again.
You know, when we ran our first mind-body group, which was in September of 1987, about a third of the patients got pregnant.
Mm-hmm.
And it was like, whoa. And that happened group after group after group after group. And I published after a year, I published after 2 years. And so then I got funding from National Institute of Mental Health to do a randomized controlled trial. And what we found was that women who did a group had a 50-something% pregnancy rate, and the controls had a 20% pregnancy rate. So we again showed a dramatic difference in pregnancy rates.
And what are some of the things that you do in the mind body program?
It's like kindergarten. We change activities every 10 minutes. You know, basically, they learn a different relaxation technique every week. So they learn meditation and progressive muscle relaxation and yoga and autogenic training and imagery and mindfulness. And they're asked to do at least a 15 or 20-minute relaxation every day. They learn what we call mini relaxations, which are focused breathing techniques that they can use for blood work and ultrasound and phone calls and social media and injections.
Just meaning like if they get triggered by seeing something on social media or, you know, seeing a pregnant woman, you know, next to them in the grocery line.
Yeah.
Okay, this is a trigger for me. And now I'm going to implement this breathing technique or mantra or something to help calm myself down.
Exactly. I mean, we basically, with the minis, we tell them there are two different situations when you do a mini. One is when you tune into the fact that you're anxious. Like you just got a phone message, your sister's pregnant. Or you just got a phone message that your cycle's not going well, or whatever. So as soon as you tune in to the fact that you're anxious, you do a mini. And those are really important and very effective. But we also want patients to use them prophylactically. So if there are situations which they know are going to push their button, do a mini ahead of time. So before you go on the patient portal to look at your results, do a mini. Before you look at your phone, do a mini. You know, before you go on social media, do a mini, because people post baby bumps and strollers and all this stuff that makes my patients nuts. And I was seeing a female patient last week, and she was saying that someone very close to her had gotten pregnant, and she was a mess and just cried for the rest of the day and couldn't function. And her husband got annoyed with her because he's like, you know, why are you so upset if someone else is pregnant? That's not rational.
Mm.
And so she's telling me this. And I said, is he working from home today? And she goes, yeah. I said, haul him down here. I'd never met this guy. And I basically gave him a 20-minute lecture on why it's entirely normal for someone going through infertility to be devastated by anybody, including a celebrity getting pregnant. It's just normal.
Absolutely. And this, go into the grocery store and all of the magazines are, you know, celebrities that are pregnant or new moms. It's this sort of mommy glamour culture. And it is absolutely triggering. And I just imagine when you get that trigger, I can imagine the body's cortisol pumping out, you know, and getting into that fight or flight. And so the act of practicing breathing and doing, I hadn't heard the term minis, but I like that. And you have incorporated these techniques into the app that you've created, the FertiCalm and FertiStrong, that I recommend to all of my patients. Can you talk a little bit about that?
So the chief psychologist at Cornell in New York is Liz Grill. She goes, have you ever thought about making an app? Okay, so I'm a dinosaur. I'm like, I don't even really know what an app is. I don't think I have any apps on my phone. I don't know how to use an app anyway. But we literally sat down and sketched out what we wanted it to be. You know, both of us are clinicians. We see patients every day. And we know every situation which pushes our patients' buttons. So not just hearing about someone else's pregnancy, but what it's like to go to the bathroom, like the last 5 days of your cycle. What it's like to be waiting for test results and have the phone ring. I mean, we know viscerally the things that make our patients so upset. So we decided to create this app, and we came up with 50 situations which we knew traumatized our patients, and each situation has 6 solutions. And so the way we designed for it to come, it looks like a flower.
Mm-hmm.
And so on the front of it are 12 categories, like the 2-week wait and sex and, family events and work issues. And so if let's say you're at a family event and your sister now says she's pregnant, you take your phone, you go in the bathroom, you find family events, and then you come up with another flower which says, surprise pregnancy announcement. And you click on that. And then there are 6 solutions, things that you can do in the moment. And so we've decided to actually revamp the app.
Mm-hmm.
So we've taken it off the App Store right now, and it's completely been redesigned. We've made sure the language is gender neutral. We've made it more modern and more sensitive and look better and everything else. So hopefully it'll come out, in the next month or so.
How does stress and infertility impact women and men differently? How do men react?
I have never in my entire career seen a male-female couple, let's say a heterosexual couple, I've never seen them handle infertility in the same way and at the same time. So, in general, the woman tends to be ahead of the man in terms of, thinking there's an issue and wanting to see a doctor and wanting to start treatment and wanting to do more treatment. So the woman always feels like he's holding her back, and he feels like she's pushing him to make decisions he's not ready to make. And it's often for a couple their first crisis. And especially if they're relatively newly married, or some couples start trying before they get married. And it's really hard because, and I just said this to this poor husband last week that I so picked on. I said, you're coping the way you need to cope. And she's coping the way she needs to cope. You need to stop pressuring her to cope the way you are. And I said to her, you need to stop pressuring him. So men generally tend to be more problem focused. And women may want to talk about how hard this is. And so she'll tell her partner how hard it is, and he'll try to problem solve.
Absolutely.
And she's like, no, I don't want to problem solve. I just want to tell you how miserable this is. He's like, no, we'll call the doctor. We'll do this. And she's like, no. So men and women handle it very differently. It's not that they don't want to be supportive. I think they just don't know how to make their partner feel better.
I also see in my own practice where so much of the testing and actual treatment, and shots, and if someone's doing IVF, egg retrieval and transfer, it's so female focused that the men feel left out and often feel almost guilty for being sad. And when I ask the couple, how are you guys doing? How are you coping? Oftentimes the male partner will say, I just want to make sure she's okay. Don't worry about me. And I'm like, no, you guys are both in this together. And, let's listen to what everybody needs. Do you find that?
I always find that. And the male partner will almost never talk in front of his partner about how he's feeling. In fact, in the Mind Body group, the men go off with a male therapist to talk about what it's like for them. There are a lot of tears. Because, they'll say, no one has ever asked me how I'm feeling. I feel like I need to be really strong for my partner. And I feel like if I fall apart, we are going to fall apart. And then you have to add to the equation, half of these couples have male factor infertility.
Mm-hmm.
And so I was talking to a patient just today. She's going through IVF because there's a male factor. And she's being poked and prodded and having injections and having retrieval to compensate for the male factor. And I talked to a husband today, and he actually said, I'm a big, tough guy, and I don't make normal sperm, and I'm watching my wife go through IVF. And he said, it's killing me.
Oh, absolutely.
And he said, you're the first person I've told how hard this is for me. He said, I feel shame, I feel guilt, I feel embarrassment, and there's no one I can talk to.
Yeah. And I think it's important if at the very least, we just acknowledge that it's okay to feel this distress and that the men are a part of this process too.
They're half of the pod.
Totally.
They really are. And I think we forget that. And, it's funny because I was taking a walk with my younger daughter yesterday, who is a college student. She's majoring in psych. And we were talking about the patients I see, because once in a while she'll walk by my office since I'm home now doing everything via Zoom, and she'll hear a male voice. And she'll go, why are you talking? Why is there a man who's a patient of yours? And I think what's really interesting is that I almost always start by seeing the female patient. And at least half the time, the partner joins us at some point pretty soon, because infertility doesn't just affect her. It affects them. And as I said, I see men alone, and it's heartbreaking to hear some of their stories. Actually, the divorce rate seems to be lower in couples with infertility versus couples with children. Because I think if you can get through infertility as a couple, you can get through anything.
Oh, I love that. Yes.
Yeah.
Beautiful.
Women have a really hard time with pregnancies, and men don't. Men just don't seem to have the same wiring that other people's pregnancies bother them as much. So it affects the couple because he wants to go to a barbecue and see some friends in non-COVID times. And she doesn't want to go because she had, she went out with the woman the week before and the woman didn't drink wine, and she thinks the barbecue is going to be a pregnancy announcement. So they fight about whether or not to go to the barbecue. So it affects the couple. It affects their sex life, because both of them start to associate sex with failure. He may think the only reason she's willing to have sex with him is to extract sperm from him. She may just figure, hey, if we're doing IUI or IVF, we can just not bother with having sex. And, for a lot of couples, and maybe especially for men, sex is a way to express love and intimacy. So basically it affects their relationship, their sex life, their relationship with their family, because their siblings are probably popping out kids and their parents or grandparents. Same with their friendships. Their friends are popping out babies, and that's all they talk about. It affects their job. I've had so many patients who are obstetricians or nurse midwives or labor and delivery room nurses or pediatricians. And all they hear all day is women complain about being pregnant or complaining about their kids, and they can't get away from it. It affects their financial status, because in most states in this country, it's not covered by insurance. And in shrink school, they tell you the top 3 things couples fight about are money, sex, and kids. And that encompasses infertility. It affects people's religiosity and spirituality, because for many people, they feel this is the first time that God hasn't answered their prayers. And then they wonder, why? What have they done? And then it affects people's body image and self-esteem. A lot of women gain weight with infertility treatment. As I said, for a man where there's a male factor, they have said, I've had a lot of male patients say they feel like less of a man because of it. So think about it. Infertility affects their relationship, their sex life, their relationship with their family, their relationship with their friends, their financial security, their job, their spirituality, and their body image. And on top of it, there are people saying, just relax and you'll get pregnant.
Oh, absolutely. One of the number one things that people say when they're trying to help, and it just makes that person feel worse.
Right. I mean, would you ever say to a cancer patient, just relax, your cancer will go away? No, but the World Health Organization has classified infertility as a disease. I mean, I'm a health psychologist. I can tell you almost every disease out there is made worse by stress. And there are a lot of diseases that are caused by stress. So why should infertility be so punitive or self-blaming, or why do people say that? I mean, you would never say to someone who is diagnosed with heart disease or cancer, MS, oh, you're probably really stressed. That's what caused it. And infertility patients hear it every day.
Absolutely.
Why do people feel that they have the right to make people feel responsible for their disease? There are a number of celebrities which have harmed people because they have twins at 52 and insist it's their own eggs. And I think that's really harmful, because then I have my 40-year-old patient saying, what do you mean I can't cycle? So-and-so just had twins at 52 and they were her own eggs. So on the one hand, I think celebrities can harm people. On the other hand, there are a lot of celebrities coming out now and talking about their struggles with infertility. I've never met Chrissy Teigen, but if I did, I would hug her.
Absolutely.
She's been so great about talking about her struggles. And then, God bless her, going so public about her pregnancy loss. And then Meghan Markle, again, I've never met her, but, an op-ed piece, what was it, the New York Times, about what pregnancy loss is. And, that normalizes it. If Chrissy Teigen and Meghan Markle found a miscarriage to be beyond devastating, then my patients will feel like, okay, you know what? I'm entitled to feel sad if I have a pregnancy loss. I'm not going to listen to all the social norms that say, don't tell anyone you're pregnant. Don't, God forbid, you can't tell people you've had a miscarriage. If Meghan Markle can tell the world she had a miscarriage, my patients can too.
Absolutely. In some way, the medical profession adds to this. I still hear colleagues tell patients, wait until after the first trimester to tell anybody that you're pregnant, just in case. Well, just in case of what? Just in case of miscarriage, which is devastating. And that's exactly when you need support. But it's hard to, in the same sentence, tell your family that you are pregnant, but it's also gone.
Well, it's interesting because my sister and I both, 5 years apart, I think, had miscarriages at around the same point. And I remember when my sister got pregnant, she told the world she was pregnant. And all her friends were like, why are you doing that? And she says, because if I have a loss, I want support. And she had a loss and got a ton of support. And I had a miscarriage in between my two kids. And again, I told the world I was pregnant and I had a miscarriage. And I got so many flowers, I had to give some away to neighbors. I mean, it was what I needed. And I can't fathom having gone through a miscarriage without the support of people I love. And so many of my patients. I did a study a few years ago, and I think it was mostly on European patients, but 57% of the women going through infertility hadn't even told their mothers.
Mm-hmm.
And I think we need these celebrities, as strange as it sounds, to bring infertility out of the closet. I mean, Betty Ford and Hoppy Rockefeller brought breast cancer out of the closet. Like, they were so public about having breast cancer. And now we have, October is all pink. And when someone is diagnosed with breast cancer, they put it on social media. So why can't infertility be the same thing? Why can't, if someone is infertility and it's a disease, why can't they tell people so the world will come to them and say, what can I do to support you? What can I do to help you? Can I make you brownies? Can I bring you dinner? Do you need a ride home from your retrieval?
Right.
That's what we need.
One thing that I hear from patients and that I faced myself when I was struggling with infertility is I was so nervous about telling people because so many people said really hurtful things. I do believe that they're trying to help, but the just relax or it's all meant to be, or it's in God's plan. Oh, great. So it's meant to be that I'm suffering. Or then you hear the stories of, my neighbor's cousin's, fifth, aunt once removed, she had 10 miscarriages before she finally had a baby. And they think that is comforting, but it's not. It's like, wait, I'm going to have 10 more of these. I just think that there's a playbook if you hear that your neighbor has cancer. All right, let's get the meals organized. Let's find the babysitting, if they've got kids or whatever it is. And you hear infertility and people don't know what to do.
So I always tell my patients, I call it snappy comeback lines. So we actually have it on the apps. We call it social solutions. And if someone they're like scripts. And if someone says this to you, here are some responses. Here's a polite response. Here's a way to educate the person. And what we had that was taken away were called zingers. So that if someone says something to you that you perceive as mean, you zing them right back.
Okay, Allie, can we role play?
Sure. So Laura, I just had a miscarriage.
Oh, everything happens for a reason.
Oh, thank you for saying that. That's polite. An educated response is some miscarriages happen for a reason and some, we don't know why, but they cause a lot of pain. And a zinger would be, do you really think that's going to make me feel better?
Oh, yes. I want to snap. I want 3 snaps.
Okay. I just want to let you know that my second IVF cycle didn't work.
Oh, well, do you think it's because you were too stressed?
A polite response would be, there's no evidence that stress impacts IVF outcome, which I don't believe, but the average person would, so just BS them. An educated response might be, there's probably a complicated relationship between stress and infertility, but I actually was doing a lot of stress management strategies, and so I don't believe in my case stress was a factor. And a zinger would be, that's a really nasty thing to say. Like if you, God forbid, were diagnosed with cancer, would you want me to say you were too stressed and you should just relax and your cancer will go away?
Oh, absolutely. Because it's basically putting blame on that person. Like if you weren't stressed, it wouldn't happen to you.
You're blaming the victim.
Right.
So what I tell my patients is like there are probably 5 or 10 things that people say that make you crazy and memorize literally snappy comeback lines. Because I'm the kind of person, if someone said something mean to me, 3 days later, I think of what I should have said.
Absolutely.
When you're going through infertility, you know what you perceive as mean. So just memorize some comeback lines. Polite, educate, and zing them right back if you need to.
I want you to respond to this.
Oh, okay.
Have you thought about freezing your eggs? I mean, you're not getting any younger, right?
Okay, so a polite response would be, yes, I've thought about it. An educated response would be, I've actually looked into it and I simply can't afford it. It's too expensive. And a zinger would be, have you thought about having a facelift? You're looking a little wrinkly and old.
Oh my God. I want to hang out with you at a cocktail party and I want to initiate, uncomfortable conversations and just hear you zing away.
The thing is, I just don't, if I've had a few glasses of wine, I probably do, but I'm just not a zinging person.
What could you say to your friend that's had a miscarriage or your friend that's having infertility?
Really good question. One is, I think they still have it. If you go on the resolve.org website, I think they still have a section on information for family and friends. Get educated about infertility. Understand that not every IVF cycle produces a baby. Understand that, 20% of pregnancies end up in miscarriage. Understand that IVF pregnancies occasionally do end up in ectopic pregnancies. Understand that working too hard doesn't cause infertility. So educate yourself about infertility. Don't assume you know what the person wants or needs unless you yourself have been through infertility. When I look back before I had a miscarriage, I'm not sure I was the most sensitive person in the world, even though I'm in the field. And, my miscarriage was 22 years ago, but now I know what I should and shouldn't say. So if you don't know what to say, ask the person. Just say, I am so sorry for your loss. I haven't been in your position, so I don't know what to say to you or what to do for you. Tell me what you need. Like, do you need a hug? Do you need a bowl of ice cream? Do you need to go for a walk with me? Is there anybody you want me to call for you? Can I go grocery shopping for you? Just tell me what you need because I can't guess.
What you're describing is how you would help anybody who's grieving,
yes,
right? Because infertility and miscarriage is grieving. It's grieving lost time. It's grieving your vision of what your family was going to be on your timeline. It's a lack of control. And I love that you also give solid suggestions as opposed to just saying, let me know how I can help. And then putting the burden on that grieving person to sort of what, you want me to make a grocery list for you? But saying hey, I'm going to go for a walk on Saturday. You want to join me? Or I'm going to the grocery store. What can I pick up for you? I think that's lovely. That's really good advice.
And sometimes someone who's had a loss or who's going through infertility may not know what they need.
Totally.
Just say, I'm here. If you need anything, I need to be the first person you ask.
Oh, I like that.
And say, I'm going to feel awful because I feel so helpless that I can't help you. And so if you don't tell me what you need, I'm probably going to do stuff that you may or may not want. So it would help both of us if you could just direct me, just let's go for a walk. Or do you want to play with my puppy or whatever?
Why do people stop fertility treatment?
Number one reason is because they can't afford to continue fertility treatment. So if you look worldwide, the number one reason is either they don't have insurance or they don't have financial resources or they've run out of the financial resources they had. Number two reason is if they do have insurance or if they have financial resources, the number one reason is stress. It's the emotional burden. And it happens. I've been doing research for the last 6 years on this. And I'm in Massachusetts. 6 IVF cycles are covered. And yet at Boston IVF, a lot of our patients don't do 6 IVF cycles. At all the clinics in Massachusetts, it's relatively uncommon for someone to do 6 IVF cycles. And it's the stress. They drop out because they're just too stressed to continue. It literally breaks my heart to think that somebody who has insurance or financial resources drops out of treatment because they're too stressed. Because if someone is at the point of doing IVF, the chances of them spontaneously conceiving are very, very low. And so if they are so stressed that they drop out of treatment, they are probably never going to have a genetic child. And although I counsel patients every day about egg donation and adoption, so I'm not saying those are second best, but it breaks my heart that stress might be the reason people will never experience pregnancy.
Yeah.
That shouldn't be, because we've done study after study after study after study showing it's relatively easy to decrease the stress levels of people going through infertility treatment. When couples are offered emotional support, they're twice as likely to move on to treatment. So it's a huge part. And, I gave a talk when I did the fellows retreat a couple of months ago. My last slide was, before I retire, my goal is for us to stop treating patients and start caring for patients. And if we can get people in our field to start doing that, I will retire and feel like I've accomplished something.
Does stress cause miscarriage?
Do I believe stress could be a factor in recurrent pregnancy loss? Yes, I do.
Yeah, it's another chicken or egg thing.
Yep.
Because it's, you've had one miscarriage, that perfect narrative of positive pregnancy test means baby 9 months later is changed. And so every time you see a positive pregnancy test after that, you're going to be cautiously optimistic or straight up terrified until you have that baby.
Terrified.
Regardless of how you conceive, if you have a provider and a clinic that will answer your questions, that will not get annoyed with your anxiety and multiple questions, and do an early ultrasound or two, that will improve the chances of pregnancy later. And I love that. And that's what we provide.
So then if I asked you the same question, then you'd probably say yes as well.
Right. It's just hard to say that, because then you don't want your patients to stress about being stressed.
I know. Except that I have to tell you, I've had so many recurrent pregnancy loss patients who admit to me they're terrified of getting pregnant. And they almost dread a positive pregnancy test, not because they don't want to be pregnant, but because they know how anxious they are during that first trimester.
Absolutely. I remember calling pregnancy tests when I was in fellowship, so training for fertility. And I called this one patient and I said, "Hey, your test is positive. I'm so excited for you." Dead silence. "Sally, are you still there?" I made that name up. "Oh, thanks, Dr. Shahine. This is really just the beginning." And oh man, that was just like a dagger to the heart, and it woke me up. And I now teach, the team here, when you call a pregnancy test, just don't be surprised if it's not complete elation on the other end of the phone, because for them, it's just the beginning.
That's right. And it's terrifying. Mm-hmm. And so what I tell my patients, and I see a lot of recurrent pregnancy loss patients because they're so anxious, is I don't want you to think 12 weeks. I want you to think today. How are you going to get through today?
Yes.
What can take up time? What can distract you? Can you go for a walk? Can you do a meditation? Can you watch Grey's Anatomy? How are we going to get through today? And that's all you're going to think about today. And when you wake up tomorrow, it's going to be, how are you going to get through tomorrow?
Right.
Forget 12 weeks. Just get through. And that makes it easier. Because when you find out you're pregnant and you have 8 weeks till you hit that 12-week mark, that's a really long time. What I tell my patients is, after the 7 or 8 week ultrasound, you start to feel better. And then when you go in at 12 weeks and you have another ultrasound and you see baby parts, you see the heart and the fingers and the toes, and you get the blood work results back, you start to feel a little better and a little more secure. But it doesn't tend to really get better until you can feel the baby move. Now, a lot of my patients rent or buy Dopplers, which so they can hear the heartbeat themselves, but then they end up going to the emergency room because they can't find the heartbeat. So in my experience, because I do follow these high-risk patients through their pregnancies, once they feel the baby move, anxiety comes way down.
Are patients with infertility or history of multiple miscarriages at higher risk of postpartum depression?
Very much so. In fact, I have a lot of patients. In fact, I just saw a new patient today who's pregnant through IVF, and her OB wants her to go on antidepressant medication now, even though she's 12 weeks. And I actually wrote a paper, a review article a few years ago about sort of the risks and benefits of taking antidepressants during pregnancy. And in fact, someone who's been through infertility or recurrent pregnancy loss is at increased risk for postpartum depression. And so one can either pile on the social support and the mind-body strategies and everything that's going to pretty well inoculate them from a postpartum depression. And if not, they can start medication, later in the pregnancy towards the third trimester when the baby is fully formed. And that would make me more comfortable.
Yeah. I also talk to patients about how it's going to feel once they have the baby. They expect that once they've met that goal, everything's going to be bliss.
Yep. Perfect.
And being a new mom is really, really hard. Lack of sleep, breastfeeding's hard, all these things, total change of life. There's this sense of not allowing themselves to complain or seek help because they got what they want. This is what they wanted. And they shouldn't, they don't feel comfortable saying, wow, this is really hard. Do you have any advice?
I see more breastfeeding patients right now than you could believe because they do expect once they have the baby, their life will be perfect. And what I tell them after the baby's born, because I don't want to scare them, is having a baby is the hardest thing you're ever going to do. And I remember, when I had my first child, I wanted my daughter more than anything I've ever wanted anything in the world. And I remember when she was 6 weeks old saying to my mother, I've changed my mind. I don't want to do this anymore. And my mother, the strong German stock said, basically, tough luck. She's yours.
I called my girlfriends and said, why did you not tell me this was going to be this hard?
Yeah.
And they said, well, it's not like it would have changed your mind. Oh, I hear you.
So, I don't think it's fair to talk to infertility patients about how hard it is to have a newborn. But I think it's something we have to talk to our patients once they're pregnant and just give them a heads up. I remember when my older daughter was about 6 or 7 weeks old, my husband came home from work and he said, what did you do today? And I said, I emptied the dishwasher. And he goes, no, seriously, what did you do today? And he's lucky he survived that conversation. So
I just so appreciate your time today. How can patients learn more, find out more about you? How can they get more Ali Domar?
I have the Domar Center, Boston IVF in Boston. So if you look under either bostonivf.com or the domarcenter.com, and then hopefully Fer to Come will be back on the Apple and Android stores really quickly. And I honestly think that's a tool that every patient should have because it's literally like having a therapist in your pocket. And so you're caught off guard and something happens that upsets you and you can find that situation and come up with solutions. I also say that, the American Society of Reproductive Medicine has a mental health professional group, and that's like 400 plus mental health professionals who are trained in reproductive medicine. And it's very easy to go to asrm.org and look under mental health professional group, and there's a listing and their therapists in every state.
You have really brought mind-body connection and the research behind stress and the connection with fertility to the forefront. You are truly an expert and world leader in this, and I can't thank you enough.
You're welcome. It was so nice to spend some time with you.
Thank you for being here today on Baby or Bust. I was just thrilled to catch up with my friend and colleague, Dr. Ali Domar. She did such a wonderful job reminding me and all of us today about just how interconnected stress and infertility can be. You can learn more from Dr. Domar at her website at the Domar Mind Body Institute, and certainly more from her multiple books you can find on Amazon. I'm Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to podcasts. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson, Nick Panella, and Andrew Greenwood for Workhouse Media. Baby or Bust is a Mark Ramsey media production.